Would you be able to help your immune system to battle COVID-19? This is the issue at the forefront of everybody's thoughts as we face an overall emergency. We don't yet have the foggiest idea how to completely forestall or deal with the harm brought about by COVID-19, the infection brought about by a coronavirus that is unfamiliar to all of us. We see online cases that we can support our invulnerable framework with pretty much everything from vitamin C or vitamin D to basic oils and silver nanoparticles. Be that as it may, how would we know which of these suggestions, assuming any, truly work? That is an intense inquiry to reply, for the most part in light of the fact that the resistant framework isn't a certain something that we can without much of a stretch measure. It's a complicated and sensitive framework with a wide range of segments. Helping one area may impede another, or boosting a specific segment may have nothing to do with battling infections. That makes recognizing what to do testing. Furthermore, how would we know whether something that assists with another infection will help with this new coronavirus? As should be obvious, there is a lot of we just can't know. At last, in the event that you are more seasoned or have a hidden well-being condition, counting diabetes and hypertension, you have an expanded danger of extreme side effects, and conceivably, death toll from COVID-19. We prescribe playing it safe to stay away from it. In case you're youthful and in any case sound, your danger of confusions is a lot lower. On the off chance that you do get the infection, you'll likely have gentle side effects and completely recoup inside 2 or 3 weeks. Nonetheless, it's conceivable that you might be contaminated with the infection without indicating any side effects. So keeping up superb cleanliness and rehearsing social segregation are vital to abstain from spreading it to high-chance people. Shouldn't something be said about low-sugar sustenance and immune capacity? As you may have perused, we accept the proof as solid to help the numerous medical advantages of eating low-carb consumes less calories. Truth be told, it might be more significant now than any time in recent memory to keep up a solid way of life, including a drawn-out good dieting design. That implies an eating design that gives basic sustenance and furthermore keeps your glucose and weight under tight restraints. Apparently people with type 2 diabetes and other metabolic conditions are at higher danger of complexities from COVID-19. The proof is certain that low-carb and ketogenic diets can be compelling instruments for treating and turning around these metabolic conditions. While we can't demonstrate that low-carb sustenance helps resistant capacity in essence, it bodes well to confine the conditions, for instance hypertension or high glucose, that may compound the situation. What's more, one late investigation demonstrated that a keto diet lessens the hazard for mice tainted with flu. That is a long ways from saying a keto diet will do likewise for flu in people or for COVID-19. However, one inquiry we should pose is, on the off chance that we follow an eating regimen that is demonstrated to help with weight reduction and metabolic well-being and may likewise gainfully influence safe capacity, what do we need to lose? In view of that, here are a portion of our top tips to diminish your hazard for contracting the infection or having complexities from COVID-19. So what are the fundamentals? These are things that you can do today that don't cost anything. We suggest you organize these fundamental strides for ensuring and improving your well-being, and conceivably your resistant framework. While these activities are constantly significant parts of keeping up great well-being, they might be urgent during times of expanded hazard, similar to now. Legitimate hand washing. The coronavirus is killed by appropriate hand washing for 20 seconds with cleanser or utilizing hand sanitizer that is more noteworthy than 60% liquor. Try not to smoke. Smokers have an expanded danger of getting diseases and experiencing serious entanglements, those contaminations. We shouldn't require more reasons not to smoke, however a period like this features the significance significantly more. Get sufficient rest. Sleep is significant for well-being by and large, and as a little something extra it might likewise profit our safe capacity. By and large, less invulnerable reaction to the flu antibody, while another investigation in twins demonstrated those with more regrettable rest had changed articulation of qualities identified with safe capacity. Last, and we can document this one under, how on the planet did they persuade individuals to do this examination? 153 volunteers were vaccinated with the rhinovirus, the infection that can cause the basic virus. They found the individuals who dosed under 7 hours were multiple times bound to create side effects than the individuals who rested over 8 hours. Once more, the science around there may not be powerful, yet with regards to in general well-being, legitimate rest makes a difference. In occasions such as these, you ought to organize rest cleanliness. In case you're segregated at home, that reasonable methods additional time on hardware like tablets, telephones, and TVs. This might be a decent time to put resources into blue light blocking glasses and to search for non-tech related exercises to do at night, similar to riddles, crosswords, or perusing a real book, not an electronic book. The perfect measure of activity, observational examinations show that the individuals who exercise will in general endure less contaminations than the individuals who don't. While those examinations have jumbling factors, the general agreement is that activity in general is likely helpful, with certain admonitions. A few investigations show episodes of difficult effort multiple and a half hours with a normal pulse over 75% at the most extreme may briefly diminish insusceptible capacity. Furthermore, tip-top competitors who overtrain will in general experience the ill effects of contaminations more much of the time than others. What is our recommendation? Remain dynamic, yet recall, presently isn't an ideal opportunity to begin another high-power practice schedule. On the off chance that you as of now appreciate arduous exercise, think about diminishing the recurrence or force by 10 to 20%. This isn't logically upheld yet is suggested by certain specialists. Likewise, attempt to concentrate on home or outside exercise. Mutual exercise center gear, similar to loads and cardio machines, might be surfaces that transmit the infection. Stress the board. While intense stressors may incidentally upgrade safe capacities, interminable stressors likely lessen safe capacity. Agonizing over the securities exchange, worrying about having enough bathroom tissue, and concentrating on the vulnerabilities of things to come can raise cortisol levels, which may adversely affect our invulnerable capacity. While information is hard to decipher around there, one investigation demonstrated clinical understudies with expanding feelings of anxiety before their last tests of the year had diminished capacity of normal executioner cells, the cells that are the specialists on call of our safe framework. We can't cause this distressing circumstance to vanish. Be that as it may, we would all be able to take measures to control our reaction to push. Contemplation, care works out, and getting outside and taking strolls are on the whole instances of exercises that are free and generally simple to do. The site 10% Happier has a free coronavirus rational soundness manage that may help. Regardless of whether stress the board strategies help your insusceptible framework or not, they can possibly help circulatory strain, glucose, and make your days significantly more wonderful. On the off chance that you drink liquor, drink with some restraint. In the midst of stress, a few people go to liquor as a method for dealing with stress. While contemplation, nature strolls, and care practices are likely more advantageous methods for adapting, for some they aren't sufficient, and liquor includes a bit of a bonus. There's no deciding here. We as a whole need to do what we can to get past intense occasions. Be that as it may, contemplates show a connection between constant substantial liquor utilization and expanded helplessness to diseases. May be generally relevant for the conversation about COVID-19, a portion of these investigations demonstrated an expanded hazard among overwhelming consumers of acute respiratory distress syndrome known as ARDS, the lung complexity answerable for the vast majority of the COVID-19 related passings. The stunt is realizing where to take a stand. While there is little science, most specialists recommend that a sensible day-by-day limit is 2 beverages for men and 1 beverage for ladies. Remember that following a low-carb way of life may diminish your resistance to liquor, so you may need to alter your admission. We should discuss supplements. Could taking nutrients, minerals, or different enhancements help shield you from COVID-19? In spite of what you may peruse on the web, this is an inquiry that can't be addressed completely. This is what we do think about specific enhancements that supposedly have resistant boosting properties. Garlic. Garlic, a mainstream and sharp herb with a trademark smell, is generally accepted to have antibacterial and antiviral impacts, including assisting with battling the normal virus. A 2014 randomized controlled preliminary found that individuals who took a garlic supplement had less colds and recuperated more rapidly from colds than individuals who didn't take garlic. Despite the fact that this is empowering, this is only one examination. Other top-notch preliminaries are expected to affirm whether garlic is genuinely advantageous for the basic cold or other upper respiratory contaminations. For the time being, appreciate garlic for its fiery flavor and undeniable smell as opposed to depending on it to support your invulnerability during the coronavirus pandemic. Nutrient C. For quite a long time, vitamin C has been utilized to help forestall the basic virus. Among different capacities, this nutrient can help keep up solid skin that gives a hindrance to germs and other destructive trespassers. Likewise, a few, however not all, examines recommend it might improve the capacity of certain white platelets that battle disease. Likewise, there is clashing proof about the potential mortality advantages of high-portion vitamin C for patients with sepsis, the most extreme type of foundational contaminations. While it's muddled in the case of taking a vitamin C supplement as advantageous for COVID-19, for a great many people there's no damage in for smokers and high-chance people, it's certainly worth considering. Nutrient C is water-dissolvable, so your body will discharge whatever you don't require into your pee. In any case, at high dosages, vitamin C may cause the runs or increment the danger of kidney stones, particularly in men, so be certain not to surpass 2,000 mg day by day. Nutrient D. As both a hormone and a nutrient, vitamin D plays various significant jobs in well-being. Lately, individuals have taken high portions of vitamin D with the expectation of boosting resistance. In any case, is this a compelling strategy? A 2017 efficient audit of 25 randomized preliminaries found that taking a vitamin D supplement appeared to have a gentle defensive impact against respiratory tract diseases in the vast majority, yet gave a lot more prominent assurance in the individuals who were extremely insufficient in vitamin D. On the off chance that your vitamin D levels are low, you may have a superior possibility of remaining great in the event that you supplement with 2,000 IU every day or more, with clinical oversight. Many, maybe even most, individuals are inadequate in vitamin D. So it's most likely savvy to take a vitamin D supplement at the present time, particularly in case you're at expanded hazard for COVID-19. Obviously, your body can make vitamin D on its own when your skin is presented to daylight, so attempt to get some sun at whatever point you can. How much sun relies upon the season and your area. A decent beginning stage is 15 minutes of presentation to an enormous body part, for example, the middle or back. Simply make sure to dodge burns from the sun, as abundant sun presentation conveys its own dangers. Turmeric. Turmeric is a flavor ordinarily utilized in Indian and Asian cooking, including curries. It contains a brilliant yellow compound known as curcumin, which rising exploration recommends may improve resistant capacity. However, there isn't any persuading proof demonstrating that it helps battle viral contaminations yet. Then again, adding turmeric to your nourishment includes flavor, and taking a curcumin supplement is probably not going to bring about any damage in any case sound individuals. In the event that you have any ailments, particularly on the off chance that you take blood thinners, check with your primary care physician before enhancing with curcumin. Zinc. Zinc is a mineral associated with the white platelet reaction to disease. Along these lines, individuals who are insufficient in zinc are increasingly vulnerable to cold, influenza, and different infections. One meta-examination of 7 preliminaries found that enhancing with zinc diminished the length of the basic cold by a normal of 33%. Regardless of whether it could similarly affect COVID-19 isn't yet known. Taking beneficial zinc might be a decent technique for more established individuals and others at expanded hazard. On the off chance that you choose to take zinc, make a point to remain beneath the furthest reaches of 40 mg for every day, and abstain from regulating nasally, because of the danger of olfactory intricacies. Echinacea. Echinacea is a herb that can apparently help forestall the normal virus. In any case, is this notoriety merited? An ongoing deliberate survey of randomized preliminaries found that echinacea may potentially have a gentle defensive impact against upper respiratory diseases, yet doesn't seem to lessen the length or seriousness of sickness. While it's difficult to state whether it may offer any insurance against COVID-19, it gives off an impression of being protected to take on a transient premise. In case you're at high hazard, you may think about taking it for the following a little while. Presently we should examine nourishment, explicitly natural products, veggies and seeds. Getting a lot of organic products, vegetables, and seeds is a typical proposal seen on numerous destinations, yet the proof is uncertain in the event that it genuinely makes a difference. In one frequently cited investigation, old volunteers were randomized to under 2 or more noteworthy than 5 everyday servings of leafy foods. They found the gathering with the higher organic product utilization had a superior safe reaction to the pneumonia antibody, however not to the lockjaw immunization. Another case is that eating the rainbow and getting satisfactory phytonutrients improves safe capacity and diminishes disease chance. Shockingly, eating the rainbow and getting satisfactory phytonutrients are ineffectively characterized terms, and such messages are normally undermined by being founded on nourishing the study of disease transmission concentrates vigorously affected by the fundamental eating regimen, for instance, for the most part in high-carb slims down and sound client inclination. Accordingly, we can't infer that any one explicit nourishment will improve your safe capacity. Be that as it may, likewise with numerous other potential medical advantages, it bodes well to adhere to an eating routine that gives sufficient basic nourishment and is wealthy in negligibly handled common nourishments. It may not be more muddled than that. Refined starches and sugars. Lab proof proposes sugar may hinder white platelet work, however no sound proof shows eating it causes you to get more contaminations. Notwithstanding, other proof proposes intense ascents in glucose may expand danger of contaminations and difficulties. Subsequently, it would bode well that we need to constrain these glucose rises. Refined starches and basic sugars are two of the greatest guilty parties for glucose spikes and thusly ought to likely be maintained a strategic distance from. This is not quite the same as saying considers show maintaining a strategic distance from these nourishments brings about less diseases. We don't have that proof. Plus, as we have referenced ordinarily, it's hard to segregate the impact of one nourishment since any nourishment's belongings must be concentrated inside the setting of the basic eating routine, for instance standard American eating regimen versus a low-carb diet. Be that as it may, one straightforward arrangement is to utilize the estimation of your own glucose as a guide. On the off chance that higher glucose is related with more difficulties, it bodes well we need to constrain that. We propose estimating your glucose either with a normal glucometer or, shockingly better, with a non-stop glucometer in the event that you approach one. On the off chance that the nourishments you eat cause your glucose to transcend 140 milligrams, think about eating something other than what's expected. Examines show that a low-carb, moderate-protein, higher-fat eating regimen viably decreases glucose and can even opposite type 2 diabetes. We don't have verification that this will support your insusceptible framework, however it might assist hold with blooding sugars under wraps, which might be related with diminished irresistible hazard. Chicken soup and bone stock. Treating colds and this season's cold virus with chicken soup might be the most well-known urban legend ever. Shockingly, it may not be 100% a legend. One investigation indicated chicken soup repressed neutrophil movement, which the creators propose could improve our capacity to recuperate from contaminations. Be that as it may, this is one of those occurrences where research facility discoveries may not mean clinical upgrades, for example, less or less genuine contaminations. However, it's difficult to contend with a delicious natively constructed soup with chicken, a couple of low-carb veggies, and a lot of genuine salt. Insusceptible promoter or not, it seems like an incredible dinner for a snowy day in self-detachment. We credit that one to great self-care. How about we examine fasting? With all the emphasis on how certain nourishments influence your resistant framework, you may likewise ponder, shouldn't something be said about fasting? One investigation in mice demonstrated that fasting, or all the more explicitly refeeding after a quick, re-established invulnerable capacity that had been stifled by chemotherapy. During the fasting time frame itself, be that as it may, it seemed to debilitate the resistant framework. What's more, the gainful reaction to refeeding might be diminished in the old. These are significant provisos. Over the long haul, discontinuous fasting and refeeding may help the insusceptible framework. In any case, during an intense pandemic, where the impending danger of contamination is higher than expected, it may not be a decent time to have a go at fasting, given the potential for a brief reduction in insusceptibility. This may sound astonishing for the individuals who have heard the expression, starve a fever. The hypothesis is that people have developed to not feel hungry and deliberately keep away from nourishment during an intense disease as a defensive instrument, which may thus restrain supplements the infection needs to repeat. Honestly, this is all guess with no quality supporting proof. Other proof proposes that ketones are valuable for invulnerable capacity, and maybe that could be the reason some suggest fasting. Yet, considering the entirety of the information together, if that were the situation, you would almost certainly be in an ideal situation eating a keto diet and not fasting. In light of the restricted information accessible, we recommend not fasting longer than 36 hours during the flare-up of the coronavirus, particularly in the event that you are more established than 60 years of age. It's coherent that you can proceed with shorter-term time-limited eating, in spite of the fact that there is no information on this either. Over-the-counter agony and fever prescriptions for coronavirus. Would it be advisable for you to take one of the regular over-the-counter prescriptions for the cerebral pains and fever that are frequently the indications of COVID-19 sickness? Specifically, shouldn't something be said about taking non-steroidal mitigating drugs, NSAIDs? These incorporate medications like headache medicine, ibuprofen, Advil, Motrin, Midol, and naproxen, Aleve, naproxen. Some treating specialists have tweeted their experience that while more youthful individuals all in all have milder responses to the coronavirus, those more youthful individuals with serious COVID-19 related difficulties will in general additionally be taking NSAIDs, for example, ibuprofen. The French health minister, who is likewise a specialist, made a general suggestion to utilize paracetamol, otherwise called acetaminophen. Note this is certifiably not another logical investigation. These are clinical perceptions from a bunch of specialists. However, is there enough worry that you ought to stay away from ibuprofen and different NSAIDs and rather change to acetaminophen or paracetamol? Some more seasoned observational examinations bolster progressively serious malady intricacies emerging from colds and influenza in the individuals who are taking NSAIDs. However, this could be on the grounds that the more extreme illnesses cause more side effects, and that is the reason more individuals take NSAIDs to battle those indications. Keep in mind, a fever is a piece of your body's reaction to battle the infection. Without anyone else, a fever isn't risky for a great many people except if it is continued over 104 degrees Fahrenheit 40 Celsius. It is awkward, yet not risky. Without having clear information, it is hard to tell what to do. In any case, maybe decide in favor of alert for the time being until better quality information is accessible. Rather than taking an OTC pill for a cerebral pain or fever, consider beginning with cool wipe showers, moist washcloths, and make sure to rest and drink a lot of liquids with electrolytes. On the off chance that you despite everything need increasingly forceful consideration, one technique could be to utilize acetaminophen first for side effects like fever or body throbs, and just on the off chance that that doesn't control your side effects, at that point consider taking NSAIDs for the most limited time conceivable to assist you with feeling much improved. In the event that you are as of now taking day-by-day NSAIDs for joint inflammation or other incessant torment issues, it is somewhat more entangled and you ought to talk about with your doctor if an elective exists, or on the off chance that you should seriously mull over changing to another medicine for the time being. We will watch out for the developing information and update this area as more data opens up. So how about we sum up everything? To put it plainly, the explanation this new coronavirus is spreading so quickly and having such a noteworthy effect on individuals around the globe is that we need resistance to it. Our safe frameworks have never observed it. The more moves we make to keep ourselves by and large solid, the better. Great hand cleanliness and social separating can help forestall coming down with the infection. Doing what you can to decrease explicit hazard components may enable your body to recuperate rapidly in the event that you do get uncovered. Regardless of whether you don't get uncovered, your general well-being may profit by the accompanying the following. 1. Eating a nutritious eating routine that limits high glucose. 2. Organizing tranquil rest. 3. Dealing with your pressure. 4. Halting smoking. 5. Taking an interest in moderate exercise that you appreciate. 6. Getting daylight and outside air where conceivable. While there isn't yet hardy logical proof explicitly around the SAFE framework and COVID-19, taking some particular enhancements may improve your general well-being and are probably going to not be destructive whenever taken as coordinated. In the case of nothing else, we suggest taking vitamin D since you might be inadequate during this season. Moreover, a low-carb diet that limits high glucose and is rich with supplements and entire, negligibly prepared nourishments may add to better in general well-being. Keep in mind, notwithstanding, that a low-carb diet doesn't have some mystical quality that will guard you from contamination. You despite everything need to wash your hands and practice social removing to forestall the spread of this new infection. Eat low carbohydrates forever. Not for the coronavirus.